Welcome to the Humble Hoof podcast. My name is Alicia Harlov. This is a podcast for both horse owners and hoof care professionals, offering discussions into various philosophies on the health of the hoof and soundness of your horse. Please check us out on Facebook or at thehumblehoof.com. A special thank you to our wonderful sponsor, Cavallo. For our Humble Hoof listeners, they are offering 15% off their Cavallo Trek hoof boots using the coupon code HRN at checkout. The Trek is the world's most popular and versatile hoof boot and Cavallo's toughest trail boot, while also doubling as an option for therapy or rehab. The front closure system makes it easily adaptable to various hoof shapes, and TPU upper design allows for maximum strength while minimizing weight for the comfort and ease of movement for your horse. These are recommended by vets and trainers and also loved as transport boots by barrel racers, show jumpers, dressage riders, and everyone in between. Again, for 15% off a pair of Treks, use the code HRN at checkout at cavallo-inc.com. A huge shout out and thank you to Surefoot Equine and Wendy Murdoch for sponsoring our 2025 Humble Hoof Podiatry Clinic here in Massachusetts this October. It is sold out, but we do have a video recording option available on my website at thehumblehoof.com/shop. Surefoot Equine is a staple here at my hoof rehab facility. We use Surefoot pads for our rehab cases to get these horses not only comfortable for standing for their trims, but to help them figure out their proprioception, to get them comfortable to release some of their soft tissue up their body, and also to decide how these difficult cases might want to balance their feet in order to open up their joint spacing up their limb. So I use these Surefoot pads nearly every single day here, and they have been a game changer for so many cases where we couldn't figure out how to get them sound otherwise. So a huge thank you to Surefoot Equine for sponsoring our clinic, where we'll be able to use the Surefoot soft radiograph blocks to determine how a horse might adjust their own balance. We're doing so much more in the clinic, so be sure to check it out on the website to see if you'd be interested in joining us virtually, or email me at thehumblehoof@gmail.com to be added to the wait list to come in person. About a week or so ago, I reached out to some trimmer friends and asked if they'd be willing to start doing a series of case study podcast episodes where we talk about some difficult rehab cases or unexpected rehab cases and what the issues presented like and how they worked through them and got these horses sound. So this is one of those case study episodes where we're going to discuss a specific horse with a specific issue. And we're starting with a trimmer in Australia named Frances Hughes, who's been trimming for about 16 years, and her own personal horse, who is an eventer, a Holsteiner eventer, who ended up having a pretty severe laminitic episode that didn't really fall into the normal diagnostic results that you would think when it comes to a metabolic horse. So Frances and I talk about her own horse and how she ended up figuring out what caused the laminitic issues and how she treated it and how that horse is doing now. Why don't you tell us a little bit about how you became interested in hoof care? Like, what was your journey getting to where you are now?
It was really rural area where there was not a huge selection of farriers was part of it, and I wanted to take control of my own hoof care. And also, I was accumulating horses.
Just your own personal horses?
Yes. So I wanted to learn how to manage them myself. So to start off with, I was trimming my non-performance horses, but my performance horse, Argentum, who I evented, I kept him in shoes and studs. Because at that time, almost 20 years ago, I think 16 years I've been trimming professionally now.
Wow.
I still thought that he needed to have shoes and studs.
So yeah, was he having any issues that made you take over his hoof care, or was he going well at the time when you started trimming?
He had an injury, just bursitis, in a fetlock from having overly long toes. And I could see that they were too long. And I talked to my farrier about it, and his response was, it was a drought. And he said, they've all got long toes because of the drought.
Because of the drought?
And because of the drought, I always remember that.
Huh. I don't think
So,
I've ever seen that.
so that's when I decided to take his shoes off. Well, because he had 3 months off work anyway, so I took his shoes off and then started him competing barefoot. And he actually won his first competition back
Wow.
from that injury barefoot
Wow.
and hasn't looked back since. And I've evented quite a few horses barefoot
That's
since
awesome.
then.
That's so great because I know, I feel like the hunter jumper world has started to open up and look into that a little bit because of the Olympics a few years ago. But in my area, which is a huge eventing area, it's still a very much, horses can't event barefoot or they have to be in shoes to do cross country. And I openly admit I am not in the show world. I am a happy hacker. Like I just do trail riding. I grew up doing dressage, but I have not done even anything, in any kind of organized discipline in so long. So I don't really feel like I have anything to say in the matter. I do have, hunter jumper clients and dressage clients that are barefoot, but my area is very, eventing heavy and they're all, they all say they have to be in shoes. So that's so interesting. And obviously this is not on the topic of what I set out to talk about today, but just because I'm curious, have you found that you had to change the trim at all in terms of, competing on grass or things like that?
When I'm competing, I wouldn't trim for 4 weeks before an event and leave myself some hoof wall, and on the day decide whether I'm going to add some traction. And so I have plenty of hoof wall to add traction. Or if the ground's a bit hard, I might take off some of the excess hoof wall so that there's not too much leverage on the wall. So leave your options open on the day
Yeah. Oh, that's
and
awesome.
manage the conditions.
Yeah. So tell me a little bit about your horse. So you mentioned that he had that bursitis and he had 3 months off and then you brought him back. How long did he compete barefoot before he started having issues hoof-wise?
He was about 10 or 11, so we'd gone up the grades to 2-star and competed at a couple of FEI 2-star events, including Melbourne 3-day event, which was a bucket list thing for me. But after that, we did a few more, and then he just wasn't going as confidently. So at the age of about 9, not going as confidently as he was before, and I dropped him down a grade or two, and he just didn't quite have the zing that he had before. And then by the time he was 10, he was occasionally just looked a bit unsteady in his hind end. And I had a equine sports medicine vet look at him, and she x-rayed him starting at the feet going up, and she diagnosed hock arthritis on the grounds that the joint spaces were a bit smaller than she would have liked them. But that wasn't great. It didn't mean a lot, and it didn't help Argy a lot. And his condition just kept getting worse. And it wasn't until it was so bad that he could barely walk and had to lie down that it was obvious that it was laminitis. But it's just not the first thing that comes to your head in a horse that's in full work, on a largely hay diet, and fit, young. It's just unexpected for
Yeah.
me.
Yeah. And especially because you said you noticed it in the hind end first, right? And that's something that's not
Yes.
typical. I mean, when I think of laminitis in my clients, it's usually something that you see as a front end hoof sensitivity initially.
It's not that it starts in the hind, but it becomes apparent in the hind as they try to take the weight off their front feet.
Okay, yeah, that makes sense.
So they take smaller steps and they try to take more weight than they can really bare on the hind feet because they don't feel great either.
Right.
And so apparently it's not that uncommon for it to be misdiagnosed in a performance horse as hock arthritis.
Yeah, that's so
I read
interesting.
Eleanor Cullen says that in one of her articles. So when he got to this fairly bad point of acute laminitis, it's still like, even in having the vet x-ray him, it still wasn't obvious because his feet were balanced, but his soles were thin. But obviously he was in a lot of pain. So I reached out to the ECIR group and used their support to start treating him from there. And they were amazing. When you sort of become a member of the group, I was allocated a mentor, and she took me through how to manage his diet, how to test the hay, what blood tests to ask the vet for, and what it all means. And it's really, even though I was a qualified equine podiatrist by this stage, we were still trained that laminitis is a veterinary issue. So we know how to trim the feet to basically to derotate them and get them growing correctly again. But all of these other issues we spoke about, but having to deal with it yourself with blood tests, with hay testing, feed testing, it's really overwhelming. And I don't think I could have got through it without the support of that group.
Oh, yeah. Yeah, I mean, the ECIR group, that's where I turned to when my gelding was initially diagnosed with navicular issues, more because I want to look at diet for growing a healthy foot. And that was sort of the place to go. And Dr. Kellen had so much information on that. But she has helped me through so many laminitis cases that, on clients that I work with. And just been an incredible resource. I cannot thank them enough for how amazing they are. But it's interesting because why I think that your story is so valuable to share, above and beyond just the fact that, it's amazing that you have like rehabbed laminitis and gone back to competing, or he had gone back to competing, is that before he came up laminitic, he was already on what people might assume would be like a safe diet, and he was in work, so you'd think that his insulin was low, but that's not the only cause of laminitic issues. So, yeah, if you could kind of say a little bit about, I know that you said it was a primarily hay diet. Was he only eating hay before he came up laminitic?
He would be getting some hard feeds, and they would be concentrates. So not a lot. Like he was never an overweight horse. He was quite lean, even lean for an eventer, because he was a big horse too. He's a Holsteiner. As I went through the processes of the blood tests and the A testing, I was advised to do the ACTH test for Cushing's, PPID, and it came back negative. But my vet at the time said, look, why don't you try him on the pergolide? You've got nothing to lose. And looking back now, this is really unusual.
Yeah, which is amazing.
It is. But I was like, why would I spend all that money?
Yeah.
For, and I got him through that laminitic episode with the diet, and, the seasons passed, months passed, and he was fine through the winter. And then in spring again, he was back in full work, competing. He was on a really strict low sugar diet then with tested hay and absolutely no concentrates. And he went down again.
This is in the spring?
And, yes. And that's when I rang the vet and said, I want to try that pergolide because I cannot control this laminitis.
And how old was he at that time? Because I know that a lot of people assume that Cushing's or PPID is just something that, horses in their 20s have.
Absolutely. And he was about 11.
Yeah.
When we started pergolide, 11 or 12. So sort of titrated it up to fairly quickly to about 3 milligrams and saw improvement quite quickly. Like the symptoms just turned around for him. And so we tooted along on 3 milligram for a while. But, the years, that's a long time ago, and the years go by. And sometimes other symptoms come up. So he would, laminitis was one symptom, but he also gets eye infections, skin infections, muscle loss, uh, tendon issues. At this time, his coat was still beautiful. He only started getting the hairy coat maybe about 6 or 7 years ago. But for the first few years, his coat was still beautiful. So basic premise on the ECIR group is the correct dose of pergolide is the one that controls the symptoms.
Right.
So whenever I would see symptoms not being managed, I would increase the dose. But I did try for a few years. You talk about the seasonal rise, we have to increase the dose, and then you'd reduce it again after that, which I would do, always trying to save dollars because it's an expensive drug.
Right.
But whenever I would drop it back, I would see regression. So I stopped doing that after a couple of years. And he's fairly stable on his current dose, which he's been on for 3 or 4 years now. But it is so much higher than anything your average horse owner would have their horse on. I've just been very lucky with my vets allowing me to manage it. He has, and over the years we've had a few more blood tests, and he's always come back in the quite normal range, like 5.
Do you know what the units are for that? Usually for my PPID clients, the numbers that I see come back when they're controlled on pergolide is usually like 20, but let me look up the units. Right. So you said he comes back at 5?
Yeah.
Wow. Yeah. So what I'm used to seeing is like, once they're diagnosed and once they're controlled, I see them, around 20 PG per milliliter. I actually don't know what the PG stands for. But then there's another one where the units of measure are p-mole per liter. And that is, I don't know, maybe Australia uses that instead. I don't know.
I think, it's not like my other clients with Cushing's ponies are looking to keep them around 20.
Oh, okay. So he's just...
So it's the same test.
Yeah, so he's just very managed.
Or his PPID doesn't affect his ACTH levels. I mean, the pituitary gland controls 5,000 hormones. They affect a lot of things in his system, but it's unusual. But there have been times when COVID was a really, really tough time for me and him. There were delays in supply, and especially the first time. I would normally order a new batch of pergolide, say a week out, and it might take 2 days to come in. So maybe the first time I ordered it a week out, and it took a month to come in or more.
Wow.
6 weeks. So I was eking out, the few days that I had, and then he went a good 2 weeks or more without any medication. So then he just went downhill, and abscesses in all his feet, and skin infections and eye infections, and it was very obvious that the pergolide was holding him together. And I use a compounded liquid. It does work. Like, I hear people saying that the compounded liquids won't work and it's so sensitive, but it definitely works for him.
Yeah. So I was going to say that. Have you seen any efficacy, or not efficacy, but like storage issues, or do you have to order just a small amount at a time to make sure that it keeps its, potency with the compounded? Because that's one of the biggest things that I think veterinarians in my area are worried about.
And that's what I hear too, but I haven't had any issues, and I haven't noticed any reduction in efficacy at the end of the bottle, because as I know, if he goes a week or 2 without the necessary dose, he will decline.
Wow. And so when you first started it, because I know that, you're talking about how he's on maybe a higher dose than what most people would assume. And I know that or assume they can give. I know that the ECIR group has a file that shows, various horses and their amount of pergolide they've gotten. I know that they've had documented horses that have gotten, over 20 milligrams a day and had, no side effects. And that's what really controlled all their symptoms, and they were thriving on that. Have you seen, or did you see any side effects? Did he have the pergolide veil at all?
No, he hasn't had that at all. When he started, and that's normally when they would get it, when they very first start. But
Mm-hmm.
on the advice of the group, I titrated it up quite carefully. And the vets don't necessarily advise you on that, or may not be aware of it so much. So I did not have any, or he did not have any side effects that I'm aware of.
That's awesome. Yeah, I think that
But
I read it's something like 20% of horses have it, and most, or I mean, ideally, right? 80% don't. I had one mare here on the property that I started on 1/4 milligram and tried to work up so slowly, and even up to 1/2 milligram, she would get a really terrible veil. And to be fair, she wasn't my horse, so I didn't, if she were mine and I was spending all the money on her, I would have done the APF Pro and the other things that ECIR recommends to see if that would have helped, but I didn't get to trial that. But I was shocked because I've never seen a horse so sensitive
I
to
had one client's horse like that also, and she probably tried 2 or 3 times to get her horse onto the pergolide, who's very, very Cushing's, sort of slightly laminitic all the time and puffy eyes and very hairy, but he could not tolerate the pergolide at all. He would be worse off. So she gave up trying, and he just muddled along for years. So, yeah, there are horses that can't tolerate it at all.
Yeah. And I think that a lot of people don't realize that that's definitely a minority, and that the majority of horses, if you titrate up really slowly and do with things, kind of the ECIR type
Exactly.
protocol. I mean, I've seen horses sound similar to what your guy went through, that they just totally turn around, and it literally changes their life and allows them to just go back to a healthy, happy existence. Whereas
Yeah.
before they were like, you kind of low grade uncomfortable all the time, or not even low grade uncomfortable.
Mm,
Some of them are
mm.
just very uncomfortable.
Yes. I have a friend who has a beautiful, very large ex-show jumper warm blood, and he he was a bit like Argy was on his feet, just never quite right, NQR. And she did everything, she could physiotherapy-wise for him. And she had him for maybe 4 or 5 years before he was diagnosed with PPID. And he turned around very quickly on medication. In a couple of months, you could see the difference in his body condition, and he became much easier to do his feet, and a much happier horse. And again, the type of horse, I think he might have been 14. And this is very recently, in the last 12 months, that he was diagnosed. Yes, so again, it's not the type of thing that will jump out at you, "Oh, he could be laminitic because he has PPID."
Yeah. And I have a horse here that I've wondered if he has PPID, but he's only 11. And so, everyone's kind of been like, I don't think it's that. And we haven't tested, but it really it's kind of in the back of my mind all the time that that's why he's not truly thriving. And
Mm,
so I
mm,
think, Dr. Van Epps, I've had him on the podcast a few times, and he talks
mm.
about how starting at age 10, he recommends doing a TRH stim test to check for early PPID. And are you guys able to do that where you are, the TRH stim?
I don't know of anyone who has used that test.
Yeah. I know that for my friends in Canada said that it's basically impossible to get it there. So I didn't know if other
Mhm.
countries were having, maybe they just don't have the same access to that.
I mean, at the time that Archie was diagnosed and we were sending his blood tests off, there was only one lab in Australia who was doing that test. I'm sure there's more now.
Yeah.
So
So And I know it's not always super accessible, but I mean, it is so valuable to have a vet that is willing to prescribe the Pergolide and allow you to trial it just to see, because I think that, some horses, I mean, even Dr. Taylor has talked about that with me before, where some horses, their ACTH levels, and you said it too, they just never show a positive, but they're so
Mm, mm.
clearly, they're so clearly
Yes,
suffering from it.
true. She has the story about one horse they could never get right, but he always tested negative to PPID. But then on necropsy, yeah, they found that he did have lesions on the pituitary gland.
Yeah. Yeah.
Mm. So I would really like to see that as an option more. It would be even cheaper than doing the blood test for the client.
Yeah.
Is let's give them a 3-week trial and see if they feel better.
Yeah. I have one client who the horse is, I think, 31 now, and he had foundered in the late summer every year for a few years in a row, but his ACTH test always came back so low, I think in the teens every time.
Mm.
And even during the seasonal rise, it was just very low. And so, we just couldn't figure out what it was. And finally, the owner asked the vet if she could trial Perglide, and this is the first year that I don't even want to jinx myself, but this last year was the first year that he didn't founder in the late summer.
Yes.
And he's on the medication. And I mean, we can't even really check blood work to see if it's controlled because it was never positive.
Mm,
But he had
mm.
all the symptoms and he was in his 30s. So it's, like, what else do you need kind of thing?
That's right.
But
Yes, and I have said that when I've had horses at my place for rehab who seem to be not quite right, if the blood tests come back okay, then the vet will say, well, it's not PPID, and just leave it there. And I'm like, no. So what are we going to do about managing these symptoms? Do you have something else? Or can I trial Pergolide with them? So I've been able to trial Pergolide with them, with that approach, like not letting them walk away and say, no, they haven't got it. Say, well, how are we going to manage these symptoms of the polydipsia, polyuria, lack of muscle, uncontrollable laminitis, eye infections, skin infections? What are we going to do about this?
yeah, absolutely. Yeah, so I mean, that's kind of like the main message that I want people to take home from this conversation is that not every PPID or Cushing's case is going to fit that mold, and maybe
Mhm.
be willing to talk to the vet about trialing medication and seeing if it helps.
Yes, sometimes, they may have PPID, but their symptoms aren't that negative. So they might be hairy, but otherwise happy. So then why would you need to do anything if you don't have to? But with laminitis, a welfare issue, like you need to do something to try and control it.
Right. Yeah.
And not all PPID horses get laminitis, as you
Right.
know. But that's what we, as trimmers, that's what we're really dealing with.
Yeah, exactly. And it's hard too because, with the cases that we work on that aren't our own personal horses, there's only so much we can do as we're not the owners. But, stories like this and advising people to kind of consider things that may be outside the box hopefully will help more horses and more owners to just give it a go and see. Because truly, I mean, and I'm not like I've always considered myself, a holistic hoof care provider and somebody who really looks for alternative answers. But when it comes to PPID, I really like Perglide is that the thing that controls it and helps to slow the progression the best. And I've seen horses just turn around on it more than any other kind of approach that I've seen people try.
Yes, absolutely. I thought I was going to lose my horse in his early teens, and that wasn't the dream that I had for him. I had got him as a foal, trained him myself, and I dreamed of having him in his 20s and being able to still ride him and enjoy him. And in his early teens, I thought I was going to lose him, and was a very long and trying journey. But here he is, he's 23 years old. He has been competing this year with a friend riding him and out and about and still loving life.
That's awesome. And so do you have any kind of last minute advice for owners that are maybe dealing with a laminitic horse or hoof care providers that are dealing with a difficult laminitic case that you kind of want to send people home with?
Don't be afraid to join the ECIR group. I think that's where the most up-to-date and simple information is. The diet is simple, the approach is simple. It's a really good place to go for direction in managing laminitis and PPID.
Yeah. ECIRhorse.org. And last time I went on the general website, it just had a big banner that says, if your horse is in crisis, click here. And it kind of takes you straight to the forum. And It's all free. I mean, it's a volunteer group and there's an incredible community and so many volunteers that are ready to jump in with information.
They also help with the management of EMS, and that's an issue that's becoming more widely known now as well.
Yeah, absolutely. Yeah, it's just an incredible community, and their protocol is what I've seen the most successful in EMS and PPID cases. Time and again, it's something that you can, repeat and see similar results. And yeah, I can't sing their praises enough. And Dr. Kellen was just on the podcast 2 weeks ago. So she's just such a wealth of information. So I'll always kind of recommend her articles and information and having others kind of look it up there. So
yes. Yeah. Yes, and we can be grateful to her to have Pergolide available for our horses.
Was she the one who kind of got it going?
I think so.
Oh, that's awesome. I have seen Dr. Kellen really kind of spearhead getting the SGLT2 inhibitors more widely available for horses with refractory high insulin. And so she's been sort of ahead of the game for so many things.
Yes, that's right. That's where the most current information is, drugs that can help your horse.
Absolutely. Awesome. Well, thank you so much for being willing to chat with me and kind of get this information out there and give hope to other people that might be dealing with a horse that they, has some laminitic issues that maybe they haven't thought to check for PPID because they might be a little on the younger side. And also just sharing your story in general and how amazing he's doing now. That's so great and such a testament to how good management can keep these guys going for quite a while.
Thanks, Alicia. It's been great to talk about Hooves and my horse.
Yeah.
I've had a lovely time.
Thank you so much.
Talk to you soon.
All right. Have a good rest of your day.
Bye.
Bye. I always say that I'm slightly more hoof obsessed than the average person, and chances are, if you're listening to a hoof care podcast, you are too. So we should probably be friends. Feel free to find me on Facebook or email me at thehumblehoof@gmail.com.